in.
Hand hygiene. Close current for privacy. Hello, my name is Natalie. I'm a student nurse for Rio Hondo. Can you confirm your name and date of birth for me, please?
Mia Sanchez, 5'10", 60.
Perfect, and that matches with your armband. Do you have any allergies, Miss Sanchez?
I'm allergic to penicillin.
Okay, so we'll make sure to keep you away from that. I'm here because the doctor has placed an order for Ciprodex. These are ear drops to help treat your ear infection. 2 possible side effects may include itchiness and discomfort of the ear. Knowing those side effects, are you comfortable with taking the medication today?
Yes, that's fine.
Sounds good. So I'm just going to do a quick assessment, making sure it's still appropriate to give you the medication.
Okay.
So I'm just going to look at your ear, assessing for any crust and drainage, which I do see. So I'm going to go ahead and grab the medication. I'll be right back.
Okay, thank you.
I'm going to hand hygiene out of the patient's room. Hand hygiene into the med room. So I have my MAR pulled up. I'm going to do my first check. So we have Mia Sanchez ordered for 2 drops of Ciprodex to the right ear twice daily. First one is going to be at 0800 and it is 0800. I'm going to go to the Omnicell, log in. I'm going to look up my patient, my last name, remove items, go to active med orders. Then we have Ciprodex here. And we're just going to remove 1. And we're going to go ahead and remove now. Open the drawer. And we have them right here. So I'm going to go ahead and do my second check. So we have Mia Sanchez ordered for 2 drops of Ciprodex to the right ear twice daily. First dose is at 0800. It is 0800. And the medication is not expired. So we could go ahead and close the drawer. And we're going to make sure to exit out of the Omnicell. Grab our barcode, and then we're going to hand hygiene out of the med room. We're going to go ahead and grab our supplies. We're going to need gauze, and some normal saline. Okay, then we're going to head back into the patient's room. Okay. Knock, knock.
Come in.
Hand hygiene. Close current for privacy. I'm back with your medication. Can you go ahead and confirm your name and date of birth for me again, please?
Mia Sanchez, 5'10", 60.
Perfect. It matches the armband, so we are good to go ahead and scan it. I'm going to log in here. Pull up my patient. And then click at bedside, and we're going to scan the patient ID. Okay, patient ID is scanned. We're going to go ahead and scan the medication and do our third check. Perfect. Make sure we have our med when we do our third check. So we have Mia Sanchez ordered for 2 drops of Ciprodex to the right ear. First dose is at 0800. It is 0805 now. Okay. Okay, Miss Sanchez, before I administer the drops, I'm going to go ahead and just clean your ear really quickly, okay?
Okay.
And go ahead and put some gloves on. Okay. So we're going to go ahead and open up our packet of gauze here. And then you would saturate it with normal saline. And then you would go ahead and just clean the patient's ear. Okay, this is now trash. My gloves are now dirty, so I'm going to go ahead and change those. Okay, now I'm going to go ahead and get ready to administer the drops. Okay, so I'm going to go ahead and pull back on the pinna to lengthen the auditory canal. I'm going to put the 2 drops on the side of the canal. And then I'm going to massage the trachea. Okay, we are done with that, and I made sure to put the cap on a barrier. Okay, Miss Sanchez, I will be back in an hour to reassess for any ear discomfort. Before I leave, is there anything else I can get for you?
No, I'm okay.
Okay, so I'm just gonna make sure that the bed is in the lowest position. The patient has the call light within reach. The environment is clean and safe. And I'm gonna go ahead and just document my procedure here. So document, and then I'm gonna say that it was given. Ciprodex given, and hit done. Okay, and then I'm gonna make sure to throw away my trash, and I'm gonna take the med with me. And I'm gonna hand hygiene out of the patient's room.